Hello, everyone, and welcome to United Way. Live United. I'm Terry Westerfield, and joining me today, I have a special guest and a friend in Mr. Leslie Jernigan, and he is a speech-language pathologist and the Chief Executive Officer of New Orleans Speech and Hearing. Welcome, Leslie.
Good morning. Welcome. Thank you.
I am so glad it's been a while, and I am glad you're here because we are now into a new school year. There are so many things that are going on, and often people don't equate education per se with a speech or language problem. And the two are so interconnected, and maybe we can use that as a jumping point to start off today's conversation.
Sure, absolutely. I think the first thing that everybody has to keep in mind that whether it's learning to read, learning to speak, learning language, whether it's English or any other language, the most essential component of that is being able to hear. And we have to know that the child can hear. There's a law in Louisiana and in many other states that when a baby is born, their hearing is tested. We then see these children after they're leaving the hospital if they didn't pass their initial testing. And at that point in time, we can say to the parent, yes, your child is hearing within normal limits, or there could be an issue. And we have capacity to diagnose that hearing loss and put hearing aids as early as 3 months of age, which is our ultimate goal. Most of our children are normal children. They may have some ear infections. They may not have the type of hearing deficit that requires hearing aids, but we have to know if a child is not learning speech, if their speech is not clear, if they're having difficulty learning to read, if they're having trouble listening to the teacher, if they're having trouble following directions in the classroom, if they have trouble even understanding what they're reading or what is being read to them. Number one, we've got to make sure that hearing is within normal limits.
And I'm talking about school, but really, as you've just mentioned, it begins far before then. We're talking as newborns.
Absolutely. That young. And people say, we had a client come in the office a few minutes ago before I left with an 18-month-old, and he says, I don't know how you're going to test his hearing. Well, that's why we have professionals. That's why we have all the equipment. That's why we know what we're doing. And we have every piece of equipment required to make the final diagnosis of your child can hear or your child has a problem. And if your child has a problem, this is what we're going to do with it. And this is how it can be fixed or how it can be rectified.
And the younger the better, because like anything, it's going to give that child an opportunity to learn more, to grow more, to be more, as opposed to struggling for so many years. And we're talking a little bit before the show, this could set one on the path for, instead of good things in life, really prohibiting some of the good things they could be.
Oh, absolutely. Within the last 2 years, we saw a young child who was about 3.5 years old. She had a significant speech problem. She had already been diagnosed with this speech problem, but the people who did the initial assessment did not test her hearing. She came to New Orleans Speech and Hearing Center. The first thing we did when we saw her was, let's check her hearing, and she's wearing 2 hearing aids now because the child's speech-language problem was caused by her inability to hear. Now, 2 years later, she's going into kindergarten. She's wearing her hearing aids. Her speech is understandable. Her language is on task, and she's actually going into kindergarten with a certain level of reading before even hitting the kindergarten classroom.
So she is ready to learn.
She is ready to learn. With her hearing aids, she will be a normal functioning child. Her speech language is beautiful. Her reading is there, and she will be a successful individual.
You know, sometimes in preparation for the show, I was looking through some of the information, I think at the National Institutes of Health and some others, and I believe even some of these figures are old. I was looking back, and I think they were from about 4 and 5 years ago, but they were talking at that point that nearly 20 million Americans, I think it's more now, 1 out of 12 is deaf or hard of hearing. And I think from what I could glean that there's some more up-to-date information that will be published soon. So it's to wrap yourself around that. I think most of us don't realize there could be that many who have this kind of difficulty.
Absolutely, and you got to remember that these are not all children because at New Orleans Speech and Hearing Center, we do hearing testing on all ages. So as the baby boomer population ages, you have several things going on. You've got the baby boomers getting older and who may not have taken as good a care of their hearing as they should. So now they're moving into that era of reduced hearing because of aging. But then the other thing that's happening, and the young kids don't pay attention to it because they think they're invincible. I believe it's 1 in 4 now children, young people in the age of, say, 15 to 22, our young population, are being diagnosed with hearing loss secondary to loud music, primarily from their earbuds. And so in their quest to enjoy their music and have a good time, they are doing so much damage to their hearing that the time will come that music will have no meaning to them. And the rule of thumb is, and parents need to listen, kids are not going to pay attention, but parents and teachers and coaches need to be aware of the fact that if you can hear the music coming out of the individual's earbuds, it's too loud.
And that's what I was going to ask. You and I may have sat in the 4th or 5th row at those huge rock concerts that used to be so popular. And I remember my ears would ring for days, and sometimes I think I'm paying the price for it all these years later. But it is amazing to me. I'll see kids walking down the street, and they've got the headsets on, not just the buds, but sometimes some of the other new headsets that are out. And the music is so loud. I thought somebody had a car window down.
Correct.
And a radio was on. And that's a constant barrage against your eardrum.
And these kids are using it all day long. If we went to a concert, the concert might have been 2, maybe 3 hours long.
Yeah.
And then we might not go to another concert for a week, a month, 2 months, 6 months, or a year. These kids are wearing these earbuds constantly. So the rule of thumb is, if you can hear it from their ears, it's too loud, and they have to learn to turn it down. Now, it's possible that they've already done so much damage to their hearing that they have to turn it up this loud just to hear it.
So we're talking about down the road here, there could be more than just we boomers who are having problems.
So we're going to have it on both ends. We're going to have our baby boomer population as well as our aging population, because the rule of thumb says that about 10% of the general population has some kind of speech-language hearing issue. So if you look at your little bitty people, about 10% of my little people are going to have it. And then you look at your senior citizen population, about 10% are going to have it. And once you hit 65, 70, part of just life in general causes the hearing to deteriorate. It's like everything else. Our vision begins to go at about age 40, and we have to wear reading glasses. And then you reach the point that the reading glasses don't work, and you have to have your driving glasses because you can't read the street signs. Well, the same thing is happening with hearing. For some reason, many of our adults, our seniors, have this fear or this appearance concern about putting a hearing aid on, but they're at the point where they can't enjoy a conversation. Other people don't enjoy being with them because you have to say everything 2-3 times. If you're a grandparent and you have a teenage grandchild, they don't want to hang out with you because they're going to want to talk and move on, and you're going to be asking, what did you say? And they're going to take the attitude, Grandma doesn't listen, Granddad doesn't pay any attention. I don't really like going over there. So isolation starts happening. The point being, so much can be done to do 2 things. One is prevent hearing loss in our young people and our musicians. We're doing a lot with the musicians here in town with different levels of ear protection. We have a standard ear protection that we give them that helps reduce the damage to the ear. Then we have custom ear protection that can be given to them, which has more filters and even does a higher quality job. And then you have your seniors who sometimes just need hearing aids, and the technology is phenomenal in today's world and changing about every 3 to 6 months, so that we can help our seniors and our adult population function better in society.
I would say this is such a wide spectrum, the age group that we're talking about, but also the services that you provide. And as we do talk about the baby boomers and aging out, I have to tease. My husband will say something, and I'm not sure. I say it's that he's got that very deep voice, and he's just kind of mumbling. And he says, "No, I can't hear anymore." And so between the two of us, then we'll start laughing. And I think it's a little bit of both, but it is. It's. I've noticed it in friends. You notice in parents. You notice in teens that sometimes it's not just not paying attention. People really, really don't hear well. and they can come to New Orleans Speech and Hearing and get help. So, Leslie, what is the first step? Is it call? Is it make an appointment? Do you come by and sign up? Tell me the different things that someone should do depending on perhaps the different age groups.
Sure. Well, everybody, regardless, we work off of an appointment system. We are booked for speech-language pathology assessments probably 2 to 3 months out. A hearing appointment can usually be booked within a 2 to 3 week period, so depending on what type of testing you want done. The first thing you do is you call New Orleans Speech and Hearing Center, and our number is 504-897-2606. We have intake clerks in the speech pathology department and in the audiology department.
Let me stop you for just one moment, because it's usually at this time that someone is racing to find pen and paper to write down that number. So, Leslie, if you'll give it one more time.
Sure. So if you need to schedule an appointment for either a speech evaluation or a hearing evaluation, you're going to call New Orleans Speech and Hearing Center. Our number is 504-897-2606, and we'll be glad to take the information. We do take a variety of insurances. Some insurances pay for some services. They don't pay for other services. So the first thing we're going to ask you is, what is your insurance? Once we know what your insurance is, what you're calling about, then we'll tell you what is required in terms of scheduling an appointment. Sometimes it's nothing more than giving us your insurance number, letting us research it, and booking an appointment. Sometimes the physician has to refer the patient to us. It depends on what your insurance carrier is going to require. Once that's all set up, you're given a set appointment, and then we will see you on your scheduled appointment day.
Now, I know that let's kind of go back to the little ones, as you say, and you have those who are the newborns and up, and you were talking about a young girl who is now going to kindergarten, because that's a good success story. You've been able to fit her with the hearing aids. Those are the different kinds of tests you give for children to adults. And the audiologist, I can remember going in, and when you were in school, they would give a little kind of a tine, and you would hear these things. Are you still doing preventive things like that in schools?
Right. We have two or three different screening programs we do. One is through a local foundation. I have a grant for 4,900 children, where I have teams that go out to the preschools, to some of the charter schools and some of the schools in the area, and do vision, hearing, and speech-language screening. So there will be a team of speech pathologists, audiologists, and technicians conducting these various screenings. And we also have a screening program in some of the private schools where the parents actually pay us for those services. Again, we're looking at vision, hearing, and speech language, all of your sensory input modes that impact your academic success. And we have some other contracts in the city where we provide similar services to children.
Now, I know that you and I are also talking a little bit earlier before the program that I was interested in seeing your website, which is a great website. Please, will you give that address quickly?
Sure. That's www.noshc, and that stands for our initials, of course, New Orleans Speech and Hearing Center.org.
Well, I was interested to see that you've gone bilingual, and may have been so for quite a while, and I just hadn't realized it. And that's important to note, because as the population changes, the city changes, New Orleans Speech Hearing Center, you're keeping up with the times.
We are, because right after Katrina, when we opened, and we opened on October the 17th, we were one of the first agencies providing services, we started getting a large number of referrals for our children who were speaking Spanish. And I recognized when reading the reports that these children were just sitting at home, they were not in any educational setting. So many of these children have delays in their native language, their primary language, so they have deficits in their Spanish, and consequently they are having difficulty learning English. So we started hiring staff. We have office personnel, speech pathologists, and speech pathology assistants who are all bilingual. And our materials are also in Spanish as well as English, so the person is comfortable when they come into our facility. And right now we have a really neat little preschool program for early language stimulation, and we're seeing a number of 3-year-olds. Not all of them are Hispanic, but we have the Hispanic in this group as well, that are just severely delayed in speech-language development. So we bring the parents in and the child with a speech pathologist and an assistant, and actually show the family how to stimulate the child in the home. The interesting thing about our first clinic that we ran for the bilingual child, and we actually had a bilingual clinic that met 2 or 3 days a week for about an hour and a half each visit. At the end of our first cycle of that clinic, all but one of those children were placed in an academic setting, which was our ultimate goal, was to get them testable, to get them to learn how to follow directions, to get them at the point that they could fit into an academic setting. And then our bilingual staff worked with the school systems and some of the preschools, and all of our children were placed. Again,
A great success.
Changing their lives, because putting them into an educational setting where they can move forward, as opposed to sitting at home, not developing good speech-language skills in Spanish and or English. There are also some standardized tests in Spanish, so we can evaluate the child in Spanish as well as in English. And with the hearing testing, of course, there's not a lot of Spanish tones, you might say, so you're getting a standard test, but our office personnel will go in and interpret for the audiologist. So it's pretty intriguing. It's what we're able to offer. I don't really know of any other facilities offering a comprehensive assessment and remediation program for these young children coming into our facility. So we're excited to be able to change with the demands of our community.
We know it's interesting, and whether it be Spanish language or English or others, you mentioned a very important component. If someone has hearing loss or is deaf, it's the whole family is involved.
Correct.
Because, especially I would think from a child standpoint, there with your parents, siblings, guardians, grandparents, everyone has a role to play in the healthy development of that child.
That's true, and it's not even with the child. Granted, when I work with the child and the parent sits in the therapy room and we tell them what to do at home in terms of how to stimulate the speech language as a part of their daily life, that's where your changes come. The same thing is happening for your senior citizen, because if the senior citizen is wearing the hearing aid, then the family members need to know how to put the battery in, how to make sure that it's working properly, and how to communicate, how to position themselves in the room so that they're looking at their face. There are many skills and adaptations that have to be done to maximize the hearing aid as it aids the person with their hearing. So it is a family affair.
I would think that, especially, again, going back to young children in particular, I'll still sometimes see the signs when you're driving around town, deaf child or beware. And that takes a little something more on the parents and perhaps even neighborhood getting to know that I'm sure they've been outfitted with hearing aids or other things, but let's be a little bit more careful.
Correct. Because you have to take special accommodations sometimes.
And these children who are just wonderful. I have not been over to New Orleans Speech and Hearing Center for a while, but it was so gratifying to see the kids and interacting with the parents. And as you said, all age groups coming in and out, and this common bond. And there's sometimes a discussion about language, about whether or not sign language is good. And I know that's often with some of the younger kids. Is it something that is still being done that you teach or others teach with whom you work?
In terms of using sign language, yes. As a speech-language pathologist who is still practicing, I use sign language and I use fingerspelling because it gives the child a language system. And people sometimes do not understand the difference between language and speech. And I will give you a perfect example. We have a young child in our clinic who we've been following for several years who is Down syndrome. Now, this child has sign language. She can communicate using language on her hands that her family can understand and is now starting to use two-word phrases. Her speech has not caught up with her language, but there are no temper tantrums. There's no frustration trying to express wants and needs, because the family can ask her, what do you want? And she can say, want, eat, want, play, which is exactly what a 2-year-old child should be verbalizing. So we are very confident, because we've given this child language, that the speech will follow. So yeah, and I use my fingerspelling a lot when I'm working with children with severe speech problems, especially the disorder called apraxia. It's just one more modality of getting the the signal into the individual child to give back. So should be no stigma about using sign language because it's a way of communication.
When a child you were talking about the success story, especially with those the young Spanish language children who were able to go to school. Do you find that there are many of the children go to mainstream, shall we say, school, or are they sometimes still going to just special schools or learning at home?
Well, if we're successful as we wish to be, unless the child has some other kind of scenario, once we get their speech language on target, they should be able to function adequately, if not excel, just like my little girl that's going to kindergarten. Just because she's wearing hearing aids does not keep her from having good speech, on-task language, and able to read sight words. And I did her test at a second grade level. So she can
she's excelling.
She's accelerated. So just because you walk in with hearing aids or have had a speech language problem. In the same vein, I would encourage parents to be very cautious because if a child is struggling in kindergarten, that child is potentially going to struggle until third grade, especially if the right testing, diagnosis, and intervention isn't completed. I have a young child right now who went through kindergarten and struggled massively. So they had the child repeat kindergarten. They got no special services. They repeated kindergarten. The child then went into first grade. This child has struggled the entire year and is now repeating first grade. So this child has been in school or in an academic setting for 4 years. Finally, they sought out New Orleans Speech and Hearing Center. We evaluated the child. We know that the hearing is within normal limits, so we don't have a hearing deficit. But this child had phonological awareness, has a learning disability, probably is going to end up with a diagnosis of dyslexia. But through the massive therapy that we've done through the second semester of last year and this summer, this child is now ready to learn. But he's lost 4 years, whereas if we had gotten him after kindergarten when he was struggling, we might have eliminated a lot of frustration. The child has low self-esteem. The child is resistant to reading. There's huge anxiety when we put any kind of text in front of him. But as the summer has progressed, and at his last visit, he is now reading to us and saying, I will read the next paragraph, or I want to read the next chapter. He now is aware of his sounds. He is now aware of how to take dictation. So we've broken the code for him by using effective therapy because of effective diagnosis. So I would encourage any parent, whether it's at the beginning of kindergarten, the first grading cycle, if your kindergartner is struggling because he can't understand rhyming words, at the end of the first grading period, the first semester, in the middle of second semester, if your child is struggling with reading, with phonics, with language, this child needs to be tested. You can use a psychologist, you can use a variety of places, but many, many times a speech-language pathologist that does the testing that we do at New Orleans Speech and Hearing Center is going to get the results they need so we can design the appropriate treatment plan and help the family and help the school and help the teacher.
And that is so impressive. It unfortunately makes me think about how many years there have been children, now grown adults and beyond, who weren't able to achieve their potential because they simply had a learning problem that no one could diagnose, and that had they known about New Orleans Speech and Hearing Center, may have been able to get the appropriate help. Because it seems like if they, as you were talking about, you're struggling in first grade or kindergarten and first grade, you're older than everyone else. Eventually, if people cannot help, if you do not know what's wrong, you're going to have a frustrated child who might just become a dropout.
And that frequently happens. You develop a lot of low self-esteem. You can frequently see behavioral problems because the child doesn't understand what's going on. He doesn't understand why he works really, really hard, and yet he's always failing his tests. And then he starts striking out at the other kids because of frustration. Or you will just see children with behavior problems because they can't communicate.
Well, I know that you were talking about that you do have psychological services. Now, is this part of for children, or is it for every client, patient who comes in who may need some additional therapy or help?
We do have a private psychologist in our building certain days of the week, and if we see children that we feel need psychoeducational testing, we can refer to them. There are a large number of private psychologists, school psychologists in the community. So whether the parent chooses to come to us first to rule out hearing and speech language, or go to the psychologist first to rule out the cognitive functioning and any possible learning disability, attention deficit disorder, or even auditory spectrum disorder diagnosis. That's another huge area we're seeing now, is children who are being diagnosed with autism spectrum disorder. And frequently we're the first to see them because the language isn't there. And so your language is pervasive in so many of your disorders and in your learning difficulties.
I know that I have a nephew who has Asperger's, and when he was quite young and they were trying to figure out, well, what is going on, that he did not seem to be able to hear, was he participating in some things? And the first stop was to an audiologist, to a physician there, and they did all the tests and had someone like yourself go in, and from there they were able to get on the right path, so that my nephew, I'm very proud to say, is doing quite well, and at 17 is amazing, amazing young man.
And that's, you have to realize that you can have one disorder and another, because we do see children who might have autism with a hearing deficit or autism with a cognitive deficit. So you have to first, as I said early on in our discussion, you've got to know that the reason the child is not speaking, is not listening, is not following direction, is not because he can't hear. And once you know that, then you start peeling away this onion until you get to the nucleus. Okay, what is going on with this child? And then your next question is, and what are we going to do about it?
Well, Leslie, I thank you so much. We have just a few minutes left. We've spent most of the time talking about children and young adults, but if we can just spend these last couple minutes here talking about our seniors again, and we baby boomers and those who might be having some hearing difficulties. I know you're by appointment only, but there are, again, hearing aids and other things that can help those who are getting up there in years, shall we say, or are just experiencing some difficulties, telephones and et cetera, and need some assistance.
Exactly. And again, you first need to know what the hearing loss looks like, because you can't recommend the right amplified telephone. You can't get the television that has the amplification system to it until you know what the patient's hearing loss is actually like. The other thing people don't realize is sometimes hearing loss can be a sign of something else, something medical. Sometimes we have diagnosed tumors that no one knew about, but it shows up on their hearing test. So if you're having difficulty hearing, you need to find out what it is, because it could be more than just wax in your ear, or it could just be wax in your ear. But again, you need to get it tested. Because of how we're structured, we purchase our hearing aids from a variety of different companies. You're not limited to any one company or any one style of hearing aid. So we're going to fit the patient with the best hearing aid for their particular hearing loss and their particular lifestyle. So there are many components that go into the placing of it. And our goal is to get that hearing aid on the patient, let them wear it, so we can change their life and make them more effective and more comfortable.
And Leslie, please, one more time, the website and your phone number.
Sure. Our telephone number, again, is area 504-897-2606. And we're at www.noshc.org, which is New Orleans Speech and Hearing Center.
Thank you so very much. Leslie Jernigan, a speech-language pathologist and Chief Executive Officer of New Orleans Speech and Hearing Center. And the New Orleans Speech and Hearing Center, a nonprofit organization and a United Way Community Impact Partner or partner agency, has been here operating in New Orleans for you since 1930. Thanks for joining me today, Leslie. I'm Terry Westerfield. And for United Way, let's all live united.